Hi everybody, it's Kathy, dietitian from Highland Primary Care in Airdrie, and this class today is called ABCDs of digestion, and unfortunately it's not that fun as it might sound from the title. So ABCD stands for abdominal pain, bloating, constipation, diarrhea, so all those digestive symptoms, and definitely we're seeing lots of those in folks lately. So this class is just a little about usually the things that I say to people most often when they come in for a first visit. And with the little disclaimer that, you know, perhaps you're doing all these things already and you're really still struggling. But usually most visits, there's something in some of this information that people can start trying right away that may make some improvement over their symptoms. And at the very least, if you're doing all these things, then we've ruled those things out and we'll try a little bit more individually tailored information. But this is the most current research we have, the most up-to-date, and hopefully it'll give you just a little bit more understanding about what might be going on down there. Of course, we don't have all the answers, but I'll tell you everything that we know currently. So what we'll talk about today is just a little bit like how we diagnose, and especially I'm going to use irritable bowel syndrome. I'm going to use that diagnosis and how they come to it, because typically that's what people are coming in for. They're either not really sure what their diagnosis is, but if they have abdominal pain, bloating, constipation, diarrhea, typically somebody at some point has mentioned irritable bowel syndrome, or maybe you've done research on your own. So we're going to talk about, do you actually meet diagnostic criteria for IBS or irritable bowel syndrome? Then I'll talk about some similarities, some things we actually do know about IBS, which may help get your head around what's happening there. And then I'm going to talk about the mind-body connection and how important that is. I cannot state enough how important that mind-body connection is. And we'll talk about some of the lifestyle things that we can do. So we'll talk about activity, we'll talk about fiber, and I'll especially focus on soluble fiber, adequate fluids, and I'll give you some cautions around bowel stimulants and what that means. I'm going to talk about medications, but really quickly, I'm definitely not the expert, but I'll give you a little bit of information. You will have connections in your medical home, either your nurse or your social worker, or of course your doctor, who would know much more about the medications than I do. So I'll give you a little bit of information, maybe just enough that will help you to ask the questions you need to. And then we'll end off with diet, because I think there's so many things that we should assess before we come to, especially making big changes or going to an elimination diet. I've just seen way too many people get really restrictive, and we may be exacerbating symptoms, and we're not really getting anywhere with it. So yeah, that's what we'll talk about. So I'll try to do it as fast as possible and keep you entertained. Some of it's pretty interesting, but maybe that's just me. I have a little nerdy side for sure. So diagnosis, the doctors have, they'll use their professional judgment on how you're presenting to see how they're gonna, what tests they're gonna order and what they're gonna do. But they will kind of be looking for, like a lot of conditions have similar, like abdominal pain, bloating, constipation, diarrhea, kind of underlie a lot of different conditions. So the doctors will kind of be looking for things like lactose intolerance. They'll probably be looking for, you know, any indication that there might be celiac disease there. And that's a condition where the villi, the body starts to eat the villi, that's the absorptive fingers. So we'll be looking for, you know, like a genetic link to celiac disease, or any sort of physiological markers that might indicate. And they may do some blood work to rule out. They may do like a celiac screen to rule out celiac disease. They might be looking for ulcers, or maybe they'll order some tests to look lower down in the intestine to rule out any inflammation like Crohn's or colitis. And also we'll be looking at reproductive cancers and lower GI cancers. We want to rule those out. We want to rule out anything more nefarious going on for sure. So Typically, so if the doctor's kind of looked at your presentation and it doesn't fit, they've done some tests and they've kind of ruled out all those other things going on, diagnostic criteria for IBS is abdominal pain or discomfort 2 or 3 times or more in the past 3 months. And some people will say it's much, much more, like it's almost every day, but 2 or 3 times. Pain generally gets better after a bowel movement. So that's something just to pay attention to. The pain typically is lower down below the belly button and gets better after a bowel movement. And sometimes associated with constipation, diarrhea, or both. Most oftentimes there will be some change in bowel habit. Yeah, so just one thing that really, really is important, if you have weight loss or blood in your stool or a fever, these are more concerning and we need to see our doctor immediately. Don't put them off. Don't discount them. Let's get in and see the doctor because there may be other things going on. Really, really important. So IBS or irritable bowel syndrome, it does affect up to 20% in Canadians, so 1 in 5, so really high. It is a little greater in women, age 30 to 50 before they're first seeking help. And, do we know for sure that it's greater in women, or are we just more likely to go get treatment than some guys will just, kind of ignore what's happening there? We're not too sure about that, but for now, who we see coming into the doctor's office, there's a little bit more in women for sure. Healthcare costs tons, $200 billion. And I mentioned that abdominal pain, bloating, constipation, diarrhea. So, and that kind of key piece with irritable bowels if the pain gets a little better after a bowel movement. So yeah, these may be other symptoms. So some of them we mentioned already, but also just being really gassy, lots of distension and bloating. People often mention that feeling of incomplete evacuation, like go to the bathroom and maybe a little comes out, but they still feel like they have to go, or mucus in stools can be some additional symptoms you might be feeling. So good news with IBS, if the doctors from your presentation ruled out all those other things or thinks that those aren't going on, IBS doesn't lead us to anything else. It doesn't turn into anything more harmful. It just is what it is. So, but remember those things that I told you to make sure you go to the doctor for if your symptoms change. So long-term prognosis is good. It's not going to turn into anything worse. The not so good news is at this time, we don't have any known cure for IBS. So the focus is just on managing your symptoms, but sometimes we can get really good management of symptoms. It can really improve your quality of life. So I always have lots of hope. And also we're learning so much about the microbiome, which I'll talk about in a little bit. Really, really fascinating, cool stuff. So there's lots of promising research being done. So there's always hope. Okay. So every single person I've ever seen with IBS presents completely different than every other person with IBS. They're very, very different, what their triggers are. It just seems to be a real variety. Like there'll be maybe some similarities once in a while, but very, very different. Their food triggers are different. It just varies really dramatically. But we do know some characteristics of IBS that we can share with you, and that's so usually in the gut there's peristalsis. So there's amazing coordination that has to happen between our brain and our head and our brain and our gut, and I'll talk about that in a little bit. But the peristalsis is like a wave, so one muscle, then the next, then the next, then the next, so like a wave to get the food to move along the digestive tract. That's how it would work when you don't have IBS. But for some reason in people with IBS, we don't see this wave, we get cramping. So the muscle contractions, for some reason, whatever reason, we don't know, a disconnect between the mind and the gut. There's a cramping on one side or the other. So say we get a cramp on the ascending colon, it might push everything through. Maybe there's a cramp on the other side, which pushes food backwards and leads us prone to constipation. So, yeah. So, and sometimes we can have both of those happening. So, who knows what's going on down there? And just those muscle contractions are not working like they should. The other thing we know, they did a really cool study. I don't know how much they had to pay people to get in this study, but they actually inflated balloons in the rectums of people with IBS and without IBS. And the people with IBS, you could put, the people without IBS, you could put about half a cup of fluid or air in the rectum before they felt any real pain. But for people with IBS, it was like a tablespoon or two. So the gut is just really, really sensitive to pain. So that means that's also good news in a way, because sometimes it could just be a little bit of gas in your gut, but it feels so painful. So it's not that anything worse is going on, or it's just that the gut is misinterpreting. So again, a disconnect between the mind and the gut. So not dissimilar to how we talk about some chronic pain syndromes, where if we look at the limb, if we look at the arm and do an MRI, it looks perfectly fine, absolutely. But there's a miscommunication. It doesn't make the pain any less real. It's very real. It hurts a lot, but it's more an interpretation, the mind's misinterpretation of what's happening that's creating that pain. So there's nothing physically wrong with the gut. And the gas tank theory of IBS, and this comes up all the time, and this is probably the most frustrating part of IBS, is that it's always a moving target. So sometimes people can tolerate something. So for the gas tank theory is like, say you just went to bed at a really good time, got a beautiful night's sleep, woke up, somebody made you breakfast, you had a great phone call first thing in the morning, your keys were where they were supposed to be, your kids were listening to you, everything was going awesome. That breakfast of pancakes and coffee went down just fine, no problems. But you know, another day, you don't sleep well, you have a fight with someone first thing in the morning, that breakfast of pancakes and coffee is not settling at all. So that's kind of the gas tank theory, and it has a lot to do with lifestyle, like things like sleep and stress. But yeah, that's the gas tank theory of IBS. So what causes it? We still don't know everything for sure, but we have some theories, and they're educated theories. So, and I have seen this one, especially a precipitating factor. So something happened, like a really bad flu or infection of some kind, and they're just never really the same after that. The other thing, that there's the microbiome, and I'll talk about that in a bit more, but the bacteria that's in the gut, so that 2-3 pounds of bacteria, for some reason it's shifted and it's out of balance, and that probably will make more sense when I talk a bit more about that. There's also a theorized hormonal cause, especially with women. Sometimes they find there's changes in their symptoms from different times of the month. So, and definitely we're looking at serotonin really closely. So if you're like, oh, I think I've heard of serotonin before, it's often linked with too little serotonin is linked with depression. But we're kind of thinking maybe too much serotonin, because serotonin is a hormone that, you know, if you bring in some kind of food into the gut and the body's like, oh, I don't like that, I want to get that out of me, we do naturally secrete more serotonin, and it helps the gut move faster. So especially with people that have more diarrhea associated with their symptoms, perhaps a little bit too much serotonin might be to blame. And then that environmental piece, because I've just seen huge, when people's stress levels really high, their issues get much more worse. So if we can kind of work on some of that lifestyle stuff, I don't know, it helps that mind-gut connection and things settle down a little bit. So I really do find that there's lots of use looking in this direction to see what's going on there. So SIBO is called small intestinal bowel overgrowth. So really the bacteria that should be in the low gut, and that's where it does its fermenting and doing its job, migrates up into the small intestine and causes all sorts of problems there. And again, we're just scratching the surface about what we know about SIBO, but I think there's enough evidence to say it does definitely exist. Some of the literature suggests in about 60% of IBS cases there might be some small intestinal bowel overgrowth. So I just don't know. I think we're just in the early stages of knowing what we know about this. But definitely something to just know about and that we can consider. So I have a question mark, low stomach acid, and this is rare. Like, our bodies are amazing and we regulate our pH balance so well. But there is some, we're starting to think about if the stomach acid's too low, and that actually might be a reason why the bacteria would migrate into the small intestine and be able to take residence there, as if the stomach acid was too low. And we do, in our culture, we do tend, if we have heartburn or anything like that, we do tend to use a lot of proton pump inhibitors to take the acid down. And then there is, again, it's very early stages, there's nothing concrete about it yet, but we're just starting to make the link between that lower acid and digestive issues, and especially over time. So just starting to look at that. I mentioned dysbiosis already, and then the leaky gut piece. So I'll just try to explain that a little bit. I think leaky gut is really misunderstood, and again, something we're just starting to learn about. But our intestinal barrier is, well, aside from the skin, that's our hugest barrier, right, from the outside. But what happens is the epithelial cells in the gut should be like such tight dentures that there's no way of anything getting in between them at all. So tight together. But for some reason, it can be genetic, it can be, maybe there's some kind of inflammation going on there. They just get a little, just enough to let a molecule pass through. And that will trigger an inflammatory, because that molecule should never be passing through there. So the body will recognize it as foreign because it's not broken down, and it'll trigger an inflammatory or an immune response. So reasons why, like I said, it could be genetic. We're starting to investigate the link between stress or trauma, long-term use of non-steroidal anti-inflammatory or NSAIDs. Some medications seem to be having a little bit of impact on the gut there. Excess alcohol intake, environmental toxic exposures, and infections. So in people that may be genetically predisposed, gluten, and more specifically gliadin, which is a big component of gluten, may cause this. But again, very early days, only in people who are genetically predisposed, so we don't recommend it across the board. So the other thing that is speculated is inflammation and the many things that cause inflammation. So it could be due to food allergy or food intolerance. Yeah, so lots of different reasons why that leaky gut piece may occur. We don't necessarily know great ways to fix it at this point. One of the reasons why they think some of the elimination diets may work is taking out whatever is exacerbating it and letting it have a chance to heal. But again, really new information. We're just kind of keeping our eye on it. But sometimes, you'll hear something that kind of resonates with you and that you want to investigate further. You want to make sure you ask questions about and talk about. So I'm just trying to give you what we know so far. So microbiome, fascinating stuff here. So there's 10 trillion cells in your human body, and there's something like 100 trillion cells in your gut microbiome alone. So when you look at the stars in the sky at night, you actually have more of those little cells in your gut. So it's very vast. And it tends to be about 2-3 pounds, and 70% of the cells of your immune system reside in the gut. So when people say your health begins in the gut, it's really very true. And so much we're learning. So I will usually in class, when we actually have class together, I show a video, a TED talk about the microbiome, which goes into some more detail. And I'll link to that at the end of this video, so you can go ahead and watch it. It's really quite good and fairly quick. But what I will say is that we know for sure our microbiomes are much less diverse than they were 40 years ago. So we've lost some of the bacteria, and also very much less diverse than more primitive cultures. So we're losing some of those key bacterial components of our gut. And we do know that one of their roles is to tell the immune system what to respond to and what not to respond to. And one of the theories of why our rises of autoimmune disease are going higher and higher, is perhaps we've lost a bacteria that was previously taught our immune system, hey, that's cool, you don't need to respond to that. So just one theory. Again, this is all kind of theorized information we're just investigating and starting to learn more about. But yeah, you are an ecosystem for sure. So what influences the microbiome? Just about everything and anything. So, you know, the way you're birthed, the way you're fed when you're little, our dietary patterns, obviously, right? We want to feed the low gut. We want to get fiber to the low gut where those bacteria reside. Medication, and especially antibiotics, that can really wipe out our microbiome or really create a shift or imbalance. Our genetics. So your microbiome is unique to you as your fingerprint. So we do share some characteristics with people we spend a lot of time with because we have the same environments, and we share some characteristics with people we're genetically related to. But yours is unique to you as a fingerprint. You can almost think of it like garden soil, and everybody's garden soil is slightly different, and everybody has slightly different things growing in their garden. So that's why it's so hard for us to pinpoint like this strain of bacteria will help your garden. It's a bit of a guinea pig science at this point, but we are learning some things. Yeah, just like I said, just like your environment, and also our hygiene has a big piece of it. And there's another theory of why our microbiomes might be less diverse. We are so clean, we're sterile. And so we might be sterilizing actually part of our gut or those bacteria that are really beneficial for us. So definitely wash our hands with soap and water, but maybe we are over sterilizing things a little bit, and that might be impacting our biome is what we're thinking about. Imbalanced microbiome, so much interesting research coming out about this and what it might be linking to. So just hear me say might, right? This early days in the research. But I would say pretty strong with allergies and autoimmune conditions. And definitely digestive issues. So we're seeing a lot of research come out about the connection between that gut microflora and things like GERD, so reflux, irritable bowel disease, that would be like Crohn's and colitis when there's actually inflammation, IBS, so irritable bowel syndrome, and just where the functional bowel disorders just means the gut doesn't work like it should. Pretty cool that we're also starting to link it with mental health. So disorders like depression, schizophrenia, starting to see some links in metabolic syndrome. So some real health conditions associated with that imbalance of the gut. Kind of neat. Yes, so I promised that I would talk to you about this, whether you want to hear about it or not. But there is a second brain in your gut. It's so neat. Like there's 5 times more neural connections in your gut than there is in your spinal cord. So there is a very powerful brain in your gut. So if you hear that, it's true. And the communication between up here and down there, that's what regulates your peristalsis. That's what regulates all your enzymes, secretion, and everything that fuels the digestive process. So really a big influence over the way our gut is functioning. And when I study a little bit more about what's happening between brain in my head and brain in my gut, brain in our heads, brain in our guts, it's amazing that more people don't have digestive issues because there's so much that the body needs to coordinate. We are really quite amazing. So that's kind of listing out the problems. And for the rest of the presentation, we're going to talk about some things that have been helpful to people. And again, just a reminder that yes, maybe you've done all these things. I do appreciate that for sure. If you've been struggling for a long time, you've probably tried everything, but these are just gentle reminders. Like I said, in my experience, there's usually something people can pull out that's just like a little nugget of wisdom that they can try that may help them with their symptoms. So, so stress reduction, better sleep. I'm just going to go over these and then we'll go into a bit more detail, but this is where we're going. Activity. So just movement. We'll talk about fiber, soluble fiber, adequate fluids, and then we'll go into the pieces on the diet that you might want to look at. So mind-body connection, can't underestimate the importance of this. As few as 4 deep breaths can help us get on the right side of the nervous system. So you may have heard of fight or flight. That's the sympathetic side of the nervous system, but rest and digest, that's parasympathetic side of the nervous system. And we sort of want to stimulate that when we're digesting. So the cool thing is that, or interesting thing that science has actually proven is that when we're eating a food and we're feeling guilty about it, we actually can change the way we digest and assimilate that because we're in the wrong part of our nervous system. So taking as few as 4 or 5 deep breaths before we eat can get us on the right side of the nervous system. Things may go down better and feel a little better for us. Lots of research to suggest things like mindfulness, stress reduction strategies. Yeah, anything that sort of uses our parasympathetic nervous system and kind of calms down that stress response can be really helpful. So things like Tai Chi, yoga, meditation, even hypnotherapy has some decent research behind it, has been shown to be useful. Psychological therapies, so things like CBT, so just looking at that thought, feelings, and behaviors, and changing any one component of those things can be really helpful. I mentioned psychotherapy and hypnotherapy, relaxation therapy, just kind of getting the body calm down. Yeah, and that piece, I'll maybe just mention that again, normalizing the enhanced sensitivity, because I've seen people. So remember when I mentioned the balloons in the rectum and that the gut is more sensitive to pain, but what we want to focus on is actually there's really nothing wrong with the gut if we looked at it. It actually is fine. So we want to just, because I've seen people get so upset, like, oh, maybe it's cancer, maybe it's a tumor, and now I'm kind of getting upset in my head and I'm overthinking and I'm making things worse. So we kind of want to calm that down and focus on, this is normal. I just, for some reason, I feel more pain when there's just normal gas in my gut, that kind of thing. So just to help out with normalizing that a bit. So sleep issues are much more common with IBS, and we don't know exactly if it's a chicken or egg kind of cycle, right? Sometimes when your gut is hurting, you don't sleep well. You know, who knows? Poor sleep might cause hormonal changes that will cause a change in your microbiome. That might cause a sensitive gut, which causes your intestinal systems, which cause you not to sleep. So it's a bad cycle, right? But trying to do any sleep strategies you can to help you sleep better it will do no harm. At the very least, it'll do no harm. So thinking about that, I won't go into that too much because we have a whole class on sleep. But all you can control is what you can control. And again, maybe you're doing everything right and you're still not sleeping well, but it's to yourself to kind of look at your sleep habits and strategies and just see if there's anything you can improve there. Activity. So active patients overall will show an improvement of their IBS scores with improved quality of life. But if inactive patients show a progression of symptoms over time. So a lot of the research papers say the mechanism is unknown, but I would say it doesn't seem like rocket science. It probably has a lot to do with stress reduction and improved muscle contraction. So, you know, just like the bicep, the gut is a muscle. So those kinds of pieces seem to just make sense. Moving the body helps us move our gut as well. Fluids, 9 to 12 cups is what they say for digestive issues, which is actually more than average. So, you know, if you think you're up there drinking 8-9 cups, see what another cup of water might do. I won't harp on that too much. And then prebiotic. So I mentioned the gut flora. That's bacteria in the gut, and you might take probiotics, which are actual bacteria that we introduce into the gut. I'll talk about that in a second. But prebiotic or fiber is the food that the bacteria in the gut actually eat. So that's what keeps them living and thriving. And truth be told, like a typical Canadian Western diet, you know, with lots of fast food and high sugary drinks, we're feeding all the upper digestive tract and nothing is even feeding the lower tract. So again, another theory why our biomes are less diverse. We just don't need as much fiber and the food that they need. So soluble fiber, I really like for digestive issues, especially, no, not especially, no matter if you have diarrhea or constipation, because the thing about soluble fiber, well, the thing about any fiber is it increases the stool bulk. So especially with diarrhea, that's a good thing. But it does decrease transit time. So it gets things moving through the gut faster. So in the case of constipation, it's also been shown to help. So soluble fibers in things like oat bran and oatmeal, ground flaxseed, your chia seed, barley, applesauce, pears, but trying not to get too much of the skin. That'll give you insoluble fiber. If you tolerate it, it's fine. Sweet potatoes, psyllium husk is something I really like, and the research is pretty good. 1 to 2 teaspoons a day. You can buy it at bulk food stores usually and just get a little bit and see if it helps you at all. With a sensitive gut, I usually recommend starting at 1/2 teaspoon and then just kind of working your way up to that 2 teaspoons. Some people work themselves up to quite a bit more. I'm not sure that more is necessarily better, and sometimes if we're not drinking enough water, maybe it's a little bit too much, and the research says 2 teaspoons. So yeah, I would maybe stop there and just see if it'll help you. And the flaxseed, you know, you can do 1 to 3 teaspoons starting out, working up to maybe a max 4. I usually like to stop people about 2 teaspoons of flax or chia, but sometimes people might work up to a little bit higher than that. And then also we get fiber from guar gum. This is something you can purchase at the health food store. And 5 grams a day has been shown to improve some of the pain associated. So there's that. Insoluble fiber. So like I mentioned, any fiber is good for the gut, but when a gut's sensitive, insoluble fiber is more fermentable carbs, so it's creating more gas. So in a gut that's already sensitive to pain, we may want to stay away from these, but you could try and just see how they are for you. So insoluble fibers, things like wheat bran or corn bran, or the skins. I don't know how often do we eat the seeds. I'm wondering why I put that in. But the skins of fruits and vegetables. So the skin of an apple or a pear, say. Legumes and lentils have both. They have soluble and insoluble fibers. So some people can tolerate them and some can't. So it's a great source of fiber, but it just depends on how your gut works. And nuts and seeds too. Same thing. So inulin is important because sometimes people will come across benefiber, and benefiber is like like Metamucil. It's like a fiber supplement, but it's made primarily of inulin, whereas Metamucil is made out of psyllium husk, which we talked about might be an okay thing. Yeah, except if it's got sweetener or sugar added, then maybe not, and I'll mention that in a second. But inulin is made out of benefiber is made out of inulin, and inulin may cause people with more digestive issues. So just be cautious around that. Also, if you're eating anything with added fiber, for example, like diabetic bars and stuff like that may have more inulin added. So if it looks like it's got really high fiber, maybe just see what the source of it is. So, and a caution with bowel stimulants. So nicotine is a bowel stimulant, alcohol is a bowel stimulant, and caffeine. And if you're still drinking a lot of coffee, I would really urge you to cut it down before you go into any more. The research is really strong. Basically in the order that I'm presenting it. We got to get the fluids up, we got to get that soluble fiber up, and if we get it up to 25 grams a day, sometimes people have significant reduction in their symptoms. The next step would be, or concurrent step would be, cutting out those bowel stimulants, because so many people are getting a lot of, I know we love our coffee and it's hard to give up, but definitely if you have digestive issues, this is the place I'd start. And it's a lot easier to give up these things than to try to do an elimination diet. So consider less is more when it comes to caffeine, alcohol, and nicotine. Okay, and back to probiotics. So things we can try, there's lots of probiotics in our food supply. Well, lots, not compared to other cultures really. But we do have yogurt, of course, which has bacteria in it. But fermented foods like the refrigerated sauerkraut or kefir or kimchi or kombucha has a probiotic in it. Fermented dairy products which would like kefir, or the BioK, which is actually a little probiotic drink you can buy. The research is pretty good on bifidobacterium and lactobacillus with IBS type symptoms. So these would be found in some of the over-the-counter supplements. However, there isn't a lot of research on the supplements themselves. So the ones I've presented here do have research, because we want to make sure that the capsule, or however the mode of, however we're getting that into us, that it actually is reaching the low intestine. Because a lot of probiotics, they're not going to make it through the stomach acid. So these products are more expensive. There's no doubt about it. But otherwise we might just be wasting our money. We don't know for sure. So one we really like, or we've been watching the research on, and it seems to be helping out, is called Align, and you can buy it at any pharmacy. So there's that one. And then VSL number 3 and Tuzin, they're usually special order at the pharmacy, and they are quite pricey. Align also has lactose, so just be cautious with that. And then the other one, if without lactose, is HMF Genstra. So that's one that's not on the slide. We don't recommend probiotics for people who are immune compromised, but otherwise the research is pretty strong that they're not going to do any harm. So I encourage people to try them as long as they can. But again, it's a guinea pig science. There's no, I can't promise anything from them. But I do like to encourage good probiotics, because I don't know, if you use a different probiotic, is it doing you any good at all? I have no idea. Although you could try and just see if your symptoms improve, then great. I've definitely had patients who have done that. So where can you go for more information on probiotic? This one, probioticchart.ca, is great, and it's up to date, and there's Canadian data, and you can look for probiotics specific to IBS, because they have a listing for that. So like I said, I'm going to talk really quick about medications. Lifestyle modifications definitely are showing more benefits than the medications. So the only thing I would state right off the hop is just, you know, maybe have a quick touch base with either your nurse or your pharmacist to see if any of your medications may be causing or exacerbating your symptoms. Some medications are known to have digestive issues. So, and usually there's simple changes that can be made, maybe changing from a brand name to a generic or something like that. So touch base with the nurse and or pharmacist. They would know more about that than me for sure. You know, let nurse or pharmacist know about any natural health products you're using. Give us the whole picture, and we'll try our best to see if anything might be factoring in there. So yeah, we don't even usually consider medications until your symptoms are impacting your quality of life, and it's just enough to get management and improve quality of life, right? They just treat the symptoms. They're not actually, like we said, there's no cure for IBS. Really wish that there were. But we usually just try to target the most bothersome symptoms, make them more manageable so that you can live and get on with your life. So for the abdominal pain, sometimes they'll prescribe the antispasmodics. Buscopan is one we see a lot, but the other ones are up to Diacetyl as well. So yeah, they can just be used pre or post meal, and can help with some of the pain for some people. So sometimes worth a try. Like I said, I'm not an expert in the medications, but I'm just going to give you some of this information so that if you want to ask more questions to doctor or nurse in the medical home, you're armed and dangerous. The bloating, so it's often fiber supplements, and I kind of mentioned those. There's not really a medication for bloating. So so sticking to the soluble fibers might be beneficial there. So like a Metamucil, but again, we don't want Metamucil with a sugar alcohol. So if it's sweetened Metamucil with a sweetener, it's usually sugar alcohol like sorbitol, mannitol, and those tend to exacerbate digestive symptoms. So we want to stay away from those. And then I don't really like the sweetened Metamucil either, like with sugar sweetened, because it'll introduce more sugar, will introduce more water to your bowels. So especially if you're prone to diarrhea, that might be something we want to avoid. So I tend to like, well, that's a dietitian's bias, right? To tend to like real food. So something like psyllium husk, so PSY, and that's what they make Metamucil out of. It's just not processed. So the constipation piece, again, fiber to the rescue. And we just talked about Metamucil, and we talked about being cautious with insoluble fiber. And in some extreme cases, maybe the doctor will recommend a laxative of some kind. It's usually not the first line, though. I want to look at other things first. Yeah, and sometimes they are using SSRI, so serotonin reuptake inhibitors, and that links into that piece I was talking about, that serotonin piece. Constella also, that just helps the movement and the way the fluid is absorbed. So yeah, that might be one that you hear about as well. And for diarrhea, Imodium sometimes is prescribed, or tricyclic antidepressants. Amitriptyline is one I see. So that may help with the abdominal pain for people with the diarrhea. And also, especially if there's any sort of mental health stuff going on, there's a big connection there. So actually, something I do know, some medications I know a little bit about are the complementary medications. So peppermint oil, so 450 milligrams enterically coated. So that means enterically means it's going to survive the stomach. Some people report a really quite significant reduction in pain. So so worth trying, especially if you don't have GERD. If you have GERD, then I don't recommend peppermint oil. Peppermint will make the door between the esophagus and the stomach really lazy, and then we'll get worsening of GERD symptoms. But as long as you don't have GERD, peppermint oil can help, and it also acts as a bit of an anti-spasmodic. And the other one is Ibrogast, and you can buy that at the health food store as well. And it's like 12 herbals. And again, it's one of those things like probiotic that's been shown to do no harm, so it's worth giving a try. And some of those herbals have been shown to improve people's symptoms. So Ibrogast. So that brings us to the diet piece. So food doesn't cause IBS, but dietary changes sometimes help with the management of it. So if we can get down the fermentable carbohydrate, for example, then we can reduce the amount of gas in the bowel, and maybe that gives a reduction in pain. So most people with digestive symptoms modify their diet. That only kind of makes sense, right? 60 to 90%. But diet changes to manage symptoms, we don't have a ton of studies about it, sadly. It's really hard to study nutrition because nobody's really making any money off it. It's not like a medication where you can sell it for a lot of money. So it is hard to get really good studies about nutrition. So we have a small number of, small sample sizes, not a lot of people in the study. And a lot of us have just been doing this a long time. So we use anecdotal evidence as well, right? We just see what has helped our clients. So, but diet changes, according to the American College of Gastroenterology, graded dietary manipulation is weak and based on low quality evidence. So, and I say that, and I do believe that. I believe there's lots of things we should do before we get to really changing people's diet. Sometimes there's little changes. We can look for triggers. We can be smarter about the way we manipulate the diet, and just not make it so hard on people. Not to say that I haven't seen some bigger diet changes work for some people, but it's just not my first line. It's not the first thing I do. I try to look at all these things kind of in order, fluid, fiber, what's going on there? How's the stress management, the sleep? I kind of look at those things first, and then we see where we go from there. So definitely strive for balance, because so often when people have struggled for a really long time, they have such a poor relationship with food and eating. They're really not giving the body the fuel it needs at all. So sometimes I just get people to step back, like, now you're malnourished, like we need to get some balance in the diet. I don't want to take anything out. I want to put things back in. And then I mentioned, of course, fiber and the fluids. Yeah. So things to watch for would be things like fructose. So free fructose, if your gut is functioning normal, it's okay. But for some people, it's really hard to digest. So if you do have high sugar, like juice, honey, pop, that kind of stuff, anything with high fructose corn syrup in it. If apples and grapes and mangoes really bother you, those have a lot of free fructose. So just that would be something to kind of pay attention to. I mentioned the sugar alcohols. So if you see things like sorbitol, mannitol, xylitol, all the alls, OL, they're often used as a sugar substitute in like diabetic candies, and I mentioned like bars and stuff like that. Gum, you might see it in gum, so watch out for gum. What's in your gum? So sugar alcohols, and then lactose, I would say, can be a problem for some people. And it isn't that big of a problem to you can use the lactase tablets. It's just the lactose we want to get after first. So you could have the lactate milk, you could have the tablets, you could have the drops that you put in regular milk, and it breaks down the milk sugar for you, and see if that gives you any improvement over your symptoms. Most commonly reported triggers, so alcohol, caffeine, fatty foods, so really rich foods, fructose, like I mentioned, wheat or gluten, meat, like again, that's probably because it's rich, dairy, and spicy food. And these aren't all the triggers, it's just the most common. So I really like people to take a bit of a health journal, or to keep a bit of a health journal. And you can, if you don't have one, sometimes people like the apps, and the apps just doesn't always give us, the health professional, something easy that we can look at. So if you love an app, for sure, go ahead and use it, whatever's going to make it easiest for you. But if you want kind of a pen and paper one, we do have one on our website, so www.hpcn.ca. And then if you click on our tab programs and then go to the health improvement program, you'll see lots and lots of resources. And one says handouts for HIP program. So HIP is health improvement program. And there's a class called ABCDs of digestion with the handouts for this class. So I like 7 days of a food journal when you come to see me, and I just look for patterns. And sometimes the best part of it is you come in knowing, oh my gosh, I noticed this happening. And that can be really great. But otherwise, I'll look for them. And I do like a health journal that also includes information on what your sleep was like and what your stress level, because I really, like I said, can't underestimate how important that is. And then we just take a note of foods that are causing the symptoms. The hard thing, the tricky thing is that with IBS, your digestion can be so much faster than what we would call normal and so much slower. So as when the average person usually takes, 8 hours to digest something, somebody with IBS, it's going through them within an hour, or it's taking 12 hours. So it's a little hard to pinpoint. So that can be complicated, but we'll look at it. Okay. Elimination diets, including FODMAPs. So if you're wondering why I haven't talked about it till now, like I said, it's not my first line of things that I would do. I try a whole bunch of other things first, because the big criticism about FODMAPs is people have a hard time sticking with it, even when they're really motivated. The other thing about FODMAPs is, please just don't get some diet off the internet and whatever, follow it. It should be tailored to you. We should, ultimately, we can make it easier. We don't need to do the whole thing. Maybe we can do pieces of it. We can look at the foods you like and see how to replace them to keep it balanced. I've just seen so many people, go off in the wrong direction and actually maybe be exacerbating symptoms by not, having a balanced diet. And it is meant to be an elimination diet. So elimination diets typically are 4, 5, 8 weeks. They're not meant to be forever. And that can be a problem, because sometimes people get on these diets and have trouble getting off them again. And a really restrictive diet for a lifetime is not fun. So we want to just be really mindful and intentional about the way we use them, and not to just, put somebody on it when they haven't tried other things that might be more beneficial. Right. So highly experimental. Quality of evidence is much higher for lifestyle and the other interventions, like I mentioned. Things like soluble fiber and water intake, much better evidence, in my opinion. Well, not in my opinion, it's true. And I just feel like when I've seen people do it by themselves, we've ended up with poor quality diets. it's very complex to follow properly, and adherence has been really low, even with supports. So that's why it's not my favorite. And I like food to be a lot more fun than that. And I think we can do it if we work at it together. So just a quick summary, that's it. The things that I think have showed the best evidence are lifestyle things like stress reduction, better sleep, getting activity. And it doesn't have to be complex, just get your feet moving, whatever movement you find enjoyable. If you're doing something and saying, I hate this, that is not helping your gut. So something that brings a smile to your face, that gets your body moving, that you would do even if it didn't have any health benefits. And yeah, if you do have, I should say, if you have lower body difficulty and movement issues, then anything that gets at parts of your body moving, right? It doesn't have to be your feet moving necessarily. We just want to be moving. Adequate fluids, and then watching those bowel stimulants. So really that's first thing. If those are high, alcohol, caffeine, tobacco, let's try, a reduction there and see if we have any improvement. Then we talked a little bit about medication, then we talked about diet, and think balance. Let's try balance first. And that's it for me. So if you do, obviously we can't have a discussion today, but if you do have questions or comments, you're always welcome to book with the team in your medical home. So your nurse and your social worker. So if you have a doctor from Airdrie out to Didsbury, right in your doctor's office, you'll have an amazing nurse and social worker who would, well, in this case, probably the nurse would be the best to answer your questions. So book in, and then they can, if they can't answer any questions that you have, they would definitely put a referral into me, and then we can meet and discuss it further. So I hope you found something in that is helpful. And yeah, questions, go see your team in your medical home, or maybe we'll connect at some point. So take really good care, and check out our other videos on our YouTube channel. Okay, bye.